YouTube, Jimmy Jones here from Guerilla Health. I've started this channel that hopefully a few of you can benefit from, myself included. I know that the learning process is certainly punctuated by the sharing process and the feedback, seeing what resonates with people, and in turn what comes back resonates with you. Obviously, all the information, so I've got this fucking like a pimple on there, alright, because I'm in a state of poor health basically, and this journey of mine is about getting healthy, guerrilla style, not like the ape, but like guerrilla warfare. The definition of guerrilla is a member or a small independent group taking part in irregular fighting, typically against larger regular forces. I think that's appropriate in this day and age of every aspect of our health in our mainstream popular society is governed by a larger force. And if you give up your independence, your responsibility for your own health, if you're not engaged in being self-aware and self-care, you are at the mercy of the medical profession, which for the most part are sincerely trying, but in a lot of cases are sincerely wrong when it comes to disease management and treatment, in my opinion. Though there are some miraculous things going on, and it's not to say don't throw the baby out with the bathwater, but I think in particular when it comes to the bread and butter diseases, heart disease, Alzheimer's, diabetes. I mean, they changed the parameters in the test results, and all of a sudden we've got a shitload more diabetic people. Just one example, we all know about pharmaceutical companies and the way they operate and who they're operating with. Okay. The other definition is referring to actions or activities performed in an impromptu way without authorization. Okay, and that's the theme of my approach to this whole thing. Is I'm not looking for the authority on what is best and what is the ultimate. I'm looking for what works. Okay, and I am going to share my experiences. We all know that the whole spectrum of information is out there, from paleo diet right through to fruitarian and everything in between. There's pretty much a study or a fucking blog, anything and everything in between that will tell you what's going on. All right, I just want to get in and get some shit done, because I'm an average guy who's had an average kind of lifestyle, very, very standard Australian diet, meat, 3 veg, processed foods. I've given the bottle a hell of a nudge. The Aussie lifestyle of work all day, drink all night, it's fun for a number of years. But comes a point where you've got to start prioritizing your health. You cannot just, it used to be go and drink all weekend, grab yourself a steak sandwich, take a dump, boom, fresh, ready to go. Okay. Nowadays, drink a 6-pack and I'm struggling the next day. So time catches up with you. I'm 37 after my birthday. And certainly I am not as flexible and bouncy as I used to be. And I realize it's not about, for me, longevity. I believe I'm going to be 99 not out, Bradman. I think that's, to me, that I'm going to live long. But it's not about that. It's about quality of life. I've experienced a range of health experiences in the spectrum. I've been to both ends, and I know that when you are feeling healthy, shit is just better. Things are better. you feel better, you are doing better at whatever it is, work, social life, relationships, um, conversations with people are more rewarding. What you have to offer is more rewarding. You can think more clearly, and you're more positive. Okay, and that's what it's about for me, is trying to navigate this human experience, um, and not be dragged down by some really common things like anxiety, depression, um, low self-esteem, and a lack of energy, and all related to just not being healthy, being overweight, having fluctuating weight, being really emotionally dependent on food, and all those things that, if we're honest with ourselves, a lot of us have experienced or are experiencing now. And those things can get more and more chronic over time and distance. If you are experiencing any type of health, how can I put it, like a disturbance in the force, whatever it is, might be anxiety. That's going to cause other things in your life. That you're going to do less of this and more of that, and generally that's negative. Okay, once you get into a cycle and into a rut, if you will, it's difficult to get out. How the fuck do you get out? I don't want to be a health guru and devote my life to the paleo diet and working out, being a CrossFitter, joining the cult of CrossFit for the rest of my days. I don't want to miss out on the things I enjoy, but I want to change my perspective on what it is that I enjoy, and I want to move it more towards healthy lifestyle. Because anybody who has done diets, workout routines, I've been there. I used, at the gym daily, been quite fit. I've also been quite overweight and depressed. For me, I know that even when you are doing well and doing healthy, there are triggers that can bring a man down. Even a woman, they're not infallible either. Am I right, ladies? Right. So, what is working? How does it work? And how can we get it done? That's what this channel's about. And hopefully, with my experience, you can see what I do wrong, what I do right, what works for me. And like I say, the information is everywhere. There's a million and one of these channels, some idiot telling you something about what he's doing. All right, but I found over years of observing this whole health, I guess, industry, this health lifestyle, this health knowledge has been my hobby, my pastime, has been something that I'm always paying attention to and probably because I come from a background of not feeling like health's a given, not having those inbuilt mechanisms where I just one of those people that lives a healthy lifestyle. That's not me. Okay, I guess I'm kind of an addictive personality. If you've got to put a label on it, I like the highs of life. I've been through the lows. I am, I set my sails and blow in the breeze. Probably take me where the wind's going a bit too often, and I want to be the captain of my ship, and I want to steer towards just more positivity in general. And so through my experience, the 7 principles of health, I realized that it's not just diet. It's not, the difference between your apple and your organic apple, and that's going to make the difference. There are a lot of factors, okay? Your air that you breathe, and the way you breathe, and what you're doing, what you're taking in, your environment, your home, all these things, the chemicals you use that you may or may not be breathing in overnight when you're sleeping, the air you breathe, the water you drink, the food you eat, whole food as it's meant to be, the symbiotic relationship between us and our environment, what we're part of, and how it's expressed in basically plants. Okay, if you eat meat, the cow's eating that grass and is eating plants that got their nutrition, or got their they're everything from sun and water anyway. And what you're getting is secondary nutrition, and whether you're a big meat eater or not, you're still that is still part of this cycle of gaining nutrition from the sun, the air, the earth into plants. Now you can eat the meat after the cow's eaten it and then get the nutrition from there, or you can go straight to the source. So they're the first three principles. They're pretty straightforward. The air, if you don't breathe, you're fucked. You are dead. If you don't drink water, you're going to be in all sorts of strife. You're going to die. If you don't eat, eventually you're going to die. Okay? The other one is walking or exercise. Okay? That's closely linked to passion, which is passing ions. To pass ions. That's your passion. What gets you moving is your passion, and that has a great impact on your health. When you're feeling low, you don't feel like you've got a purpose, things aren't good, you feel like shit. All right? And that manifests in the physical body. So passion, non-toxic relationships, and there's one more. I think it's sunshine. Air, water, food, and sunshine. We are electrical beings. We are complicated little things, and nature is extremely complicated, and there are, for example, 1,200 phytonutrients in sunlight. Okay, since the 70s, we've been told, the sun is here to kill us and cause us cancer. Obviously, anything in excess, if you are not in a position, health-wise, skin-wise, skincare-wise, to be out in the sun 8 hours unprotected, you are going to get burnt. But you certainly do need sunshine. It's just one part of a broad spectrum of the 7 principles of health. So as you're chugging along, doing your weights, you're a CrossFitter, you're awesome, you're muscle, you're doing your Instagram. Half of these people that you see as really healthy kind of people are going through excruciating experiences, mentally, also physically, internally. Your external physical being is not always a representation of your health. That's something I know from experience. You can be some really fit-looking meth addicts. All right, they're lean, they're looking good. All right, but they'll steal your TV and try and stab you. Which is not a healthy mindset. So, of course, in my true form, this video is long and convoluted. This is a learning process for me. I feel like I've got a lot to share, only because I've been through a lot of ups and downs, and I'm hoping that this process of sharing and having a purpose to share it with people is going to help me, and hopefully those experiences can help you in some way or another, because it's all out there. All the information's there. It's about, in a way, it's like stripping away the other shit and remembering, or coming back to what is health, what is true, what is really at the core of a healthy life. At this stage, I don't know how to put that into place. It's very difficult for me, but I know the place to start, something I can take care of and influence, is my physical body, and in turn build on that and create a better mindset, which will be a constant improvement cycle, and living consciously, deciding what I want to eat, how I want to live, what I want to do it. To me, that's not easy. It takes discipline, and I'm hoping that that's an area I can improve on. But anyway, enough rabbiting on. If it sounds like something you want to keep an eye on, check out now and then, get onto it, subscribe, like, do the YouTube thing, put a comment down there, and tell me how messy that shelf is and how crap my beard is. any budding young medical students out there, just throw it in there and tell me how medical science is doing so well with all our vaccinations and pharmaceutical and miracle pills and supplements. Why every country in the world with access to the most amount of modern health tools and mechanisms is basically the most fucked. The most, you know. So let's get into it. Let's talk about it. Let's stop bashing ourselves for not being there. And let's pat each other on the back for having a go. So hopefully it'll be a bit of fun. Alright? I'm signing out for now.